For 1.7, the discharge instructions. This is a standard form for a discharge. It will be done purely in the computer and then printed off afterwards. There's a spot up at the top for the client's name, the patient's name, the admission date that they were done. There could be a release date here, but since this is probably done typed up before the animal is actually checked out, that usually does not show up yet. The procedure that was done: dental prophy and polish, dental cleaning. There's a list of checkbox here for medications. Like for this client, we would be starting medications tonight: Rimadyl and Cephalexin tonight, give with food. We would go over the patient that the patient can have only small amounts of food and water tonight. Normal feeding can resume tomorrow. Feed the pet his or her regular diet, and offer water with no restrictions. We would list off that if it was a surgical procedure like this was a mass removal, you can resume normal activity within 10 to 14 days. Try to confine indoors. Take outside on a leash only for elimination for the next 10 to 14 days. No running or jumping for 14 days. Kind of emphasize over the clients. I know some of the clients have difficulty trying to confine an animal from running or jumping in the house. For the for sutures here, there's a spot for no sutures, or the sutures are observable. But for this patient, they will have to be removed in 10 to 14 days. We advise the client to make the appointment either before they leave the building or to check their schedule and call back. We just usually give out an e-collar of some kind if they have sutures, to discourage the pet from licking or chewing at the surgery site. We advise the owner to check the incision line daily for any swelling, redness, or discharge. If it appears irritated or infected, to notify us. Follow-up instructions are to recheck in 10 to 14 days. Here for monitor, we advise them to call the practice if there is any of the following occur: a loss of appetite for more than 2 days, pain, the sutures come out, any discharge, change in breathing, straining to urinate or defecate, the list goes on, vomiting, diarrhea, swelling. Any special instructions that the doctor types in here, like the surgery went well, no complications, doctor will call when we receive the histopath report. The teeth were scaled and polished, no extractions were needed. Please keep the e-collar on at all times until her recheck appointment and sutures have been removed. After hours, we advise the owner they can call us, but after closing time, all our calls are directed to our sister hospital, or they can call the Capital District Animal Emergency Clinic at this number, and then we would give them this form. Usually the name of the staff who goes over is here, and then we would have the client sign here.